Hi, I'm Quan. I'm the mayor of Oakland. And as the mayor of Oakland, I've been working with Let's Get Screened to Oakland, a project that was started by my predecessor, Mayor Dellums. We know that in America that some communities continue to contract AIDS and become HIV positive at higher rates than others. And that's particularly true in Oakland among women of color and women who are lower income because they have less options and less medical care. Oakland is a city that's very diverse. It is a city, though, that has a diversity of income and education and outcomes. So Get Screened to Oakland is a critical project because most people who are HIV positive don't know that they're positive, and we're hoping that by educating people and letting them know that we can start reducing the number, particularly of women of color and other minorities who become HIV positive. I have a special relationship with the whole story about HIV because my husband is a doctor, and when we first came back from California, he worked at the men's clinic in San Francisco, and I remember him coming back and talking to me about this disease that seemed to really strike men, where there were high rates of cancers, and that seemed to be fatal. And later, when I became an organizer for SEIU and worked with the Hospital Workers Union, I actually represented many of the hospital aides and the janitors and the other health workers in the hospital who are not doctors or nurses. And people were very, very scared. And I remember being part of a committee that we pulled everyone together, from doctors to janitors, and talked about what we then knew about how you could get HIV. And at that time, one of the things that the workers were very concerned about was, can you get it through vendors? Can you get it through handling dishes? And it pretty much became clear that blood and needle pricks maybe was the most dangerous thing. I remember sitting at this table of a lot of very high-paid doctors and people ignoring the lower-paid workers who were there. And finally, this one custodian said, you know, if they just put the needle containers down lower and not hanging them on the walls, it'd be less dangerous for us because we can't see when they're full or if it's overflowing, and we might accidentally get stuck. And I remember thinking, I said, you know, this is the kind of thing that if you let healthcare workers participate, where that idea may have saved many people. And he was just, quote unquote, a janitor, but he had a lot of practical experience in how to deal with making the hospital safer and how to make sure there are less needle sticks. And so I always talk about that story, about that being probably the most important idea that came out, even though we had all these surgeons and other professionals. And so that was something like HIV. It's something that we all in the community have to worry about, and they really have to worry about protecting future generations, particularly of young people, from getting the disease. Now AIDS is no longer fatal. When I started out as a healthcare representative for hospital workers, we thought it was going to be fatal for anybody who got it. But again, because we made it a national priority, because we've had research, we're now able to save people's lives. Now whether they can afford to cure is another issue. So that's why HIV detection and having it done early and getting people screened early is absolutely critical, so that we can save people's lives, that we can get them the care that they need, and more importantly, that we can prevent a lot of young people in the future from becoming infected with HIV. So we support Let's Get Screened to Oakland, and I hope that other people who are working in communities of color and with people who don't have access to health care will spread the message and to make sure that they take advantage of the free screening that we provide in the city. Thank you.